Welcome everyone. Thank you for joining us here at Aspen Ideas Festival. I'm here with Dr. Ignacio Saez and I'm going to be talking to him today about his work in treating people who have depression. And so my first question is, the societal and economic burden of depression is huge, yet antidepressants remain ineffective for many people. So are other treatment options needed?
Well, as long as we have patients who we can't treat, I would say the answer is a resounding yes. And we think of depression as having multiple tiers of treatment. There's behavioral interventions and there's pharmacological interventions, but there's a significant subset of patients that don't respond to either of those. And we do need new treatments for them, right? Because this is a devastating disease. It has a huge burden on their families, on their lives. So yes, we do need new therapeutical treatments so that we can treat and cure as many patients as possible.
How can looking at electrical activity in the brain help you understand the biological basis of brain disorders like depression?
So part of what we do in my lab is do exactly that, examine electrical activity in different brain regions. And that reflects something about how the brain is functioning at a given point in time. And what we think is that in diseases such as depression, that pattern of brain activity is altered. Right? And understanding what the differences are between a healthy brain and a brain who's suffering from depression are the first step towards developing new treatments. It's a necessary first step, and from then on, we can progress.
What does the process of gathering this information actually look like? In other words, please describe the surgical interventions of the neurosurgical teams that you work with.
Yeah, my lab takes a unique approach in collaboration with our clinical colleagues, and we work with patients who have surgery and they have the electrodes implanted directly in different parts of the brain for a treatment of a variety of disorders, including epilepsy. I'm mentioning epilepsy because that gives us a very generous coverage of different brain areas, and there's a significant comorbidity with depression. So we can actually use this intervention, which is feasible because of clinical reasons, to study their depression directly. And so what we do is, once the patients have been operated on by our neurosurgeon colleagues, they're under observation for a few days while this electrical activity from different parts of the brain is being recorded and monitored. And we engage with them and we do different types of cognitive experiments to understand how their brain activity differs depending on their depression status. So like I said before, this is kind of the first stage to identify which brain areas malfunction in depression and how can we address that malfunction.
How does understanding the neurological and neurobiological basis of depression lead to new, more effective treatments?
So traditionally, like I said, we have pharmacological treatments, and a subset of patients don't respond to those. One possibility is that we need more targeted treatments, and by that I mean that not all brain areas are equally malfunctioning in depression. And these surgical interventions give us a unique opportunity to identify which areas are malfunctioning and how. But also, they have a flip side in which we can actually electrically stimulate those areas and try to normalize brain activity, bring it back to normal, and potentially address their depression and hopefully cure them.
Are there a lot of people out there who could potentially benefit from the neurosurgical therapeutic approaches that you're talking about?
Yes, definitely. I mean, treatment of depression is in its early stages, but we do have surgical treatments for Parkinson's disease, and it's used as a diagnostic for epilepsy, and that diagnosis for treatment for epilepsy leads to very good outcomes, and it is kind of severely underutilized across the health systems in the United States. The prognoses are very good, but there's of course it's kind of intimidating to undergo brain surgery, but what the data shows is that these surgeries are very effective, and we should be using them more often.
What would you say to people who are suffering from depression, not responding to treatments, and are losing hope?
I would say, as much as possible, hang in there. And we know you're suffering, and we're working very hard. Lots of teams of people with clinicians and researchers and so on who want to find a way to treat you, to cure you. And we're really hoping to make strides in the next few years so that we can address your depression appropriately and help you have a healthy, happy life.
So thank you, Dr. Saez, for answering those tough questions. Really appreciate it, and thank you everyone for joining us.
Thank you.